Hey ladies! Today I wanted to go over a different component of breast augmentation. I feel like when people hear breast augmentation, their mind automatically goes to implants, forgetting that there's more than one meaning to the term. Breast augmentation also means breast reduction and breast lift. Now, I've never had a breast reduction, so I won't ever be making a video on that, but if you've seen my other videos, then you know that I also got a breast lift with my breast implants. So in this video, I want to go over what exactly a breast lift is, the different types, how to know if you need a breast lift, and give you an idea of which type of breast lift you may need. Okay, so let's get started. So what is a breast lift? A breast lift is a surgical procedure that raises and firms the breast. This is done by removing any excess skin, which tightens and repositions, giving the breast a more youthful appearance. A breast lift can also reduce the size of your areola if you wanted it to do that. Pretty simple, right? Okay, so how to know if you need a breast lift? Okay, so firstly, if you've already met with a surgeon and he told you that you'll probably need a breast lift, well then you probably need a breast lift. I would take his advice. If you're wanting to get implants and don't want the extra costs of the breast lift included, I would say just kind of bite the bullet and do it, because if you get implants and feel like you're so saggy afterwards, you're definitely going to be regretting not getting the lift right then and there. Another way to determine if you need a breast lift is if your nipples point downward or if your nipples fall below the crease of your breast. And here's also a quick tip to see if you need a breast lift or not. Okay, so for this trick you'll need yourself and a pen or a pencil. Take your hand and place it over your breast and lift up. Now take your pen and place it in the crease of your breast. Now let go of your breast. If the pen falls, then you're good. Probably don't need a lift. If the pen stays, and luckily I'm having trouble getting it to stay, then chances are you just may need a lift. Okay, so now that you know what a breast lift is, and now you might have some insight on whether or not you may need one, let's go over the different types of breast lifts. Now, I may not have all of these written down, but these are the only ones that I know of, but your doctor may have something different up his sleeve, I guess. So the anchor lift. Alright, so in an anchor lift, an incision is made around the perimeter of the areola, down the center of the breast, down to the breast crease, and horizontally along the breast crease. This is good for someone who has a severe amount of sagging, or this is also the technique I believe is used in a breast reduction. And the result would end up having a scar looking like this, but over time I'm sure it would fade. The next type of lift is more if you have a moderate to severe concern with sagging, and that is the Lollipop lift. And what you would do is there would be an incision made around the areola and down to the crease of the breast, and you would end up having the scarring look like that. So once again, that's for moderate to severe sagging. Then there's the donut lift or Benelli lift or peri-areolar lift, which is the lift that I got, and this is for mild to moderate sagging or tubular malformation, which is the reason why I got the lift. If you don't know what that is, I guess I'll make another video one of these days explaining that. So with that, you would just make an incision around the areola, and the scarring will look like that. And if you saw my 3-month update video, I showed the edge of the scarring, so you could kind of see what that looked like. Okay, so those are some of the types of lifts available. Of course, to know for sure which type of lift that you may need, or if you need one at all, definitely check with your surgeon, because he'll advise you in the best way possible. Okay, so if you're interested in this, and you'll probably want to know how much does it cost. It really varies on your doctor and your general location, but most breast lifts average between $3,500 and $6,000. Now I say average, now mine costs $2,200, so it doesn't have to be $3,000. It just depends on where you are and who your doctor is. And of course, as with anything, there are some risks included. Possible risks include unfavorable scarring, hematoma, blood clots, skin loss, risks associated with anesthesia, skin discoloration, persistent swelling, asymmetry, temporary or possible permanent loss of sensation in the nipples, unhappiness with the result, recurrent looseness or sagging of skin. Whew! Okay ladies, so I hope you found this quick video helpful in some kind of way. Maybe you got some questions answered about the different kind of lifts and whether or not you need a lift. Maybe you thought you did and now you don't, but still don't go off 100% of what I say because I'm not a doctor, but just trying to help. Okay, as always, if you have any questions or if you'd like me to make a video on a certain topic, feel free to leave it below or message me. And I will talk to you ladies next time.